Thank you very much to you. So thank you, Cynthia Mwase from the Gates Foundation. Thank you to the panel that really delivered an interesting and a compelling case for why innovation matters, and investing in innovation and allocating so many more resources towards R&D helps to build resilient systems. We're now moving on to discuss domestic capacity and local manufacturing. Just by way of introducing this segment, I just feel it would be remiss of me, standing in this beautiful South Africa that's hosting the G20 this year, not to remind you that it was on the 11th of November this year that BioVac launched South Africa's first locally developed oral cholera vaccine. It deserves an applause. That's us South Africans, you will applaud. And on speaking about it, the chief executive of BioVac, Dr. Morena Mokwane, he said it's the first time in over 50 years that a vaccine is fully made in South Africa. And then adding to that, the Medical Research Council said that it's a vital step in strengthening the country's ability to respond to infectious diseases. And I suppose that is self-explanatory. So when we talk about local manufacturing and self-reliance, this is exactly it. You want to build the capacity and the capability of local markets to respond to local needs. And so in this conversation now, we are going to garner the insights of Sherwin Charles, who's the co-founder of Goodbye Malaria. He's also a member of the board for the Global Fund. And I'm going to invite Sherwin to join us. And subsequent to that, we're going to hear from Patrick Says from Vestergaard. But first, Sherwin. And what I'll do before you make your presentation, I'm going to ask you a question, leave you to respond, and then we'll listen to your speech. And my question is, why, in your opinion, is local manufacturing and self-reliance vital for health resilience? We keep talking about health resilience in South Africa and the continent. Why would local manufacturing really add value? Are you going to be the podium? Fantastic.
Thanks. Thank you very much, Lorata. And welcome, everybody. I think there's never been a better time for this discussion to be held. You've just given a great example of a local solution that has been brought to market in a timely, speedily manner. We've been through a pandemic, and what has the pandemic taught us? It really taught us that Africa was last in the queue. We saw that supply chains had become affected. We saw a global shutdown. And if we talk about resilience, if we talk about equity, if we're talking about access and speed, then local manufacturing is not aspirational. It's become essential. It's on those principles that we started Goodbye Malaria, and I'm glad to have Robbie in the room with me, as well as all the colleagues that I know so well, and you've just heard on the last panel. Goodbye Malaria was built on the fundamentals that elimination of malaria in Africa has to be community-led and led by Africans. And we started Goodbye Malaria on the basis of doing a regional program cross-border. Not an easy option, fought with a lot of challenges, particularly around supply chains, delivery, timelines. Malaria season does not wait for the delivery of insecticide or bed nets or medication. Climate change has impacted when the rains start. So we need new solutions. And as Paul had said earlier, it can't be business as usual. And one of those new solutions is really ensuring that local manufacturing takes place. Now, this is not just about local ownership, but it's about partnerships with those like we've seen in the panels before me, speaking about bringing innovation to market. How do we take that innovation and ensure it's established on the continent? And Tom, congratulations, and you'll hear from Patrick soon, to having production in Kenya. That'll ensure that we get speedy access to new innovations. The tools need to be closer to the communities, and that is critical. We talk about local ownership, we talk about community ownership, but this needs to translate into local production, secured supply chains, secure logistics, and all of that would lead us to the term we're all talking about called health security. We know that local manufacturing creates jobs, it creates capabilities and capacity, and economic growth. And if we look at the history of malaria, no country has eliminated malaria without economic growth. It goes hand in hand. We can have all the interventions we want, but until communities can afford to do this for themselves, we are not going to cross the winning line. And so it's incredibly important that we look at this holistically. And part of that is ensuring that those investments that are spent in local manufacturing, the reward is local. We've seen a change in global health politics. We've seen a change in attitudes and where development aid is going. The term we keep hearing is transition. Africa needs transition. How do we do that? It's by building capacity. It's by ensuring we have the tools at hand locally to make a difference. Malaria will not be eliminated on the continent unless we achieve these goals. But what's so important is that we cannot set ourselves up to fail. Whatever we build needs to be sustainable. And that sustainability comes out of partnerships, comes out of products, interventions that are culturally appropriate, that are impactful, that understand the local conditions for its implementation. In terms of Goodbye Malaria, one of the important things we observed was that on the continent we had amazing policies. The right strategies were in place, strategic documents were there. But we saw that transition from national health to local implementation was a challenge. And so bringing private sector partnerships to bear with national strategies, with national policies, allowed us to have incredible impact on the ground. We need to ensure that there is a technology transfer. We need to ensure that we build the capacities and the skill sets that are needed for malaria elimination. We have to create the future where Africa leads. We need our own tools, we need faster access, we need lower costs, we need stronger health systems, greater resilience to the shocks that will come along our way. And of course, we need the confidence to drive our own agenda. And this is how we will accelerate to elimination and face the next health challenge that is on the horizon. I want to say in conclusion that investing in African manufacturing is a long-term commitment to health, prosperity, and security. It is time that we shift from dependency to self-sufficiency. And it's how we ensure that the tools that save African lives are increasingly made in Africa for Africa. Thank you.